Patient advocate is the unseen hero of medical world, jack of all trades. 80% of women are advocates for the vulnerable at clinics, hospitals, and veterinary hospitals for the deaf, blind, mute, chronically ill, women, and the elderly. 17.5% of advocates will be men? Some have shown mansplaining behavior, or an ego on getting second opinion when first one said no. Advocates fight against medical gaslighting from First Doctor or an ER. The behavior of medical gaslighter is downplaying symptoms, dismissing symptoms as anxiety. They interrupt you. They don't run or delay tests, screenings. Blame your BMI, race, gender, lifestyle. Refuse to recommend you to specialists or to run tests. This causes you to feel crazy, stupid, or dramatic. They deal with hospital bills someone can't pay, so it needed adjusted. An insurance company denying meds, tests, or hospital stays. They address complaints to the doctors, nurses, specialists in board meeting during annual review. They guide patients through healthcare system and ways to pay your medical bills debt when insurance company decides they won't cover your hospital stay. They ask important questions on med dosage treatment and stuff about discharge care after surgery. They plan discharge plan for the patient and their family, reviewing things like support system, ability to pay, are they in poverty, do they live alone, can they drive? They ask why a patient is not getting pain meds, tests, screenings, or why is it being delayed? Sometimes doctors hold unconscious racist ideas that Black people don't need pain meds. They give advice on how to handle their new diagnosis, or when someone is dying, on their will, on who to add, or if they want to sign a do not resuscitate order. They educate their clients on getting second opinions or a new diagnosis, about malpractice lawyers gaslighting, and how to avoid flare-ups. They review coverage or a patient's case with a medical social worker on ways to help the patients they are assigned to. But battling insurance on denials breaks something in them, on their trust with the healthcare system. It gets tiring. The new grad phase of their job wears into burnout and anger at why is health insurance not free? They have to fight against sexism, racism, classism, ableism, bias on a patient's background, or the idea that people of color are just alcoholics, drug addicts, and are just seeking pain pills. They face moral dilemma on if someone is faking their illness for drugs, money, or attention, or if they are real patients seeking a diagnosis for what's going on with them. They have to bruise a doctor's, nurse's, insurance company's ego to get through to them. The job becomes high-pressured and high-stakes. They face a real risk of resistance on being held actionable for wrong dosage of meds, treatments, and billing, and denying things like chemo, brain surgery, a wheelchair or rehab facility. They face a fear of being made to sign an NDA to shut up and stop nagging, or being fired, blacklisted. Due to conflict of interests, they cannot advocate for their family, friends, partners, or best friends because you can become emotionally compromised. They work in eye clinics, addiction rehab, hospice, palliative care, pediatric intensive care unit, ICU, neonatal intensive care unit, in ER, plastic surgery clinics, cancer treatment hospitals. They advocate for elderly, the disabled, kids, families, and for dying in hospice or peds hospice to make things less hard than it really needs to be. Advocates sometimes are told thank you and some gifts for advocating for their kid, mother, or a dying relative. And you get to solve mistakes, problems in billing, debt, or treatment or meds, which can bring a sense, of satisfaction, of making a difference. And UJOB helps give a voice for worried family or the patient's concerned symptoms doctors missed during exams. Advocates build a generational bond with clients over years of working as advocates. You learn something new every day at work. It's a flexible job that allows you to meet diverse people and diverse jobs over the years. And you get to hold doctors, nurses, hospitals, clinics, and people accountable for medical mistakes like overcharges, incorrect bills, wrong meds, treatment, or misdiagnosis. Advocates are summoned by a patient saying, "I want an advocate,"